welcome to my YouTube channel, The Niharika Tells. I am Dr. Niharika Mishra, a certified homeopath and a certified nutritionist, and I am so glad to finally be on YouTube. So in my previous video, we have discussed everything about osteoarthritis, and in this video, we are going to discuss about the basic difference between osteoarthritis and rheumatoid arthritis. So let's discuss about it further. So osteoarthritis is a non-inflammatory disease and rheumatoid arthritis is an inflammatory disease. So what is inflammation? Inflammation is when we can see the redness, swelling, pain, warmness in our different joints. So we all know about osteoarthritis, that is, it is a wear and tear disease in which our cartilage got destroyed. But rheumatoid arthritis, it is an autoimmune disease. So what is an autoimmune disease? An autoimmune disease is when our body's own immune system is working against our antibodies. That is we call as an autoimmune disease. So the disease onset is early, that is 20 to 40 years in rheumatoid arthritis, and the disease onset is late, that is above 50 years in osteoarthritis. So in osteoarthritis, we have discussed earlier that the joint affection is symmetrical, but in rheumatoid arthritis, it is asymmetrical. And also we have discussed another point that osteoarthritis usually affects the larger joints, that is the knee joint, the hip joint, whereas rheumatoid arthritis affects the small joints, that is our wrist joint or the finger joint, etc. So there is no other system involvement in osteoarthritis, but rheumatoid arthritis is usually associated with rheumatoid heart disease, rheumatoid fever, Felty syndrome, etc. This stiffness, especially the morning stiffness, is usually quite high in rheumatoid arthritis, that is more than 1 hour, but it is quite less, the morning stiffness is quite less in osteoarthritis, that is less than 30 minutes. And another main point is, in osteoarthritis, the pain is better by rest, but in rheumatoid arthritis, the pain is usually aggravated by rest. So what is the lab diagnosis? In rheumatoid arthritis, we will find the rheumatoid factor is positive and with elevated ESR and CRP. Why? Because there is sign of inflammation. But in osteoarthritis, the RA factor is negative and ESR and CRP may be increased or may be normal. So another very important point which I really want to discuss is, if you have ever sore throat or fever and you have self-drugged yourself and also get cured, but in return it increases the risk of having rheumatoid heart disease and rheumatoid fever in your case, because mostly the sore throats are associated with streptococcus, and if you have not taken antibiotic, then you have the chance of having the rheumatoid heart disease. That's why always consult a doctor before taking any kind of medicine. So let's discuss about homeopathy medicines for rheumatoid arthritis. The first medicine is Rockstuds when the pain and stiffness is aggravated by rest and ameliorated by motion. Another medicine is Bryonia when the pain and stiffness is aggravated by slightest motion and ameliorated by complete rest. In advanced rheumatoid arthritis, we can take Causticum when the joint involvement is usually deformed. Another medicines are Lidumpal and Calmia. In Calmia, the pain is usually in downward motion, and in Lidumpal, the pain is usually in upward motion. Another medicine is Actias plicata when the involvement of joints are usually wrist and finger and the smaller part of joint. So this is all about rheumatoid arthritis versus osteoarthritis. If you like this video, please subscribe to my channel, and thank you for watching.